Important message. If you're a senior living in the United States, United Kingdom, Canada, or Australia, or you have loved ones who are, understanding the impact of food on aging is not just a health tip, it can change lives. The right foods can dramatically improve memory, lower the risk of chronic diseases, and even reverse fatigue. What you eat after 60 affects how you feel every single day. One of the most overlooked but powerful foods for better health condition in seniors is salmon. This isn't just about some trendy omega-3 buzz, it's about the real biological effect this fish has on aging bodies. Salmon is packed with long-chain omega-3 fatty acids, particularly EPA and DHA, which are critical for brain function, heart health, and inflammation control. Seniors in the United States often deal with conditions like congestive heart failure, atrial fibrillation, cognitive decline, and arthritis. And salmon helps fight all of these from the inside out. Clinical trials in Canada and the UK have shown that seniors who consumed fatty fish at least twice a week had sharper cognitive performance and lower triglyceride levels. In Australia, older adults who incorporated omega-3 rich diets had significantly lower markers of systemic inflammation, which is directly tied to joint pain, autoimmune issues, and even cancer risks. Some stories coming from long-term care homes in Florida report seniors with previous memory struggles becoming more socially active and engaged within just months of shifting their diet toward omega-3 rich meals. Omega-3s also impact eye health, which is essential considering how many seniors suffer from macular degeneration or cataracts. But you can't just eat any kind of salmon. You need to choose wild-caught, preferably from cold waters, like Alaskan or Pacific salmon, because farmed fish is often loaded with toxins and can do more harm than good. In the United States, especially, processed food culture is everywhere. Even seafood can be deceptive. Always read the labels. Another powerhouse food that absolutely needs to be a regular part of a senior's diet is leafy greens, particularly kale, spinach, collard greens, and Swiss chard. These aren't just diet foods. They are deeply nourishing for every cell in the body. They provide essential vitamins like K, A, C, and folate, which are directly tied to bone density, immune function, and blood clotting. Vitamin K is especially critical. Seniors in the US and UK often face osteoporosis and frequent fractures, and most don't realize that vitamin K plays a crucial role in calcium metabolism. Without it, calcium cannot properly bind to bones. Canadian researchers found that seniors who included high vitamin K greens in their diet had stronger bones and a lower rate of hip fractures. In fact, in a large-scale UK study, older women who consumed just one serving of leafy greens per day had reduced risk of cognitive decline by 40% over 5 years. It's not just about the vitamins either. Leafy greens are loaded with nitrates, which naturally help lower blood pressure, improving blood flow and reducing the workload on the heart. That's critical in the United States, where millions of seniors live with hypertension, often without even knowing it. In Australia, clinical nutritionists have started using high-nitrate foods as a frontline defense against cardiovascular issues in older adults. Plus, greens are fiber-rich, which supports gut health. Many older adults deal with constipation, diverticulosis, or even colorectal cancer. And fiber is one of the few things that can effectively support colon health without medication. But here's what seniors must be careful about: cooking them properly. Overcooking leafy greens can destroy many of the nutrients, especially vitamin C and folate. Steaming or light sautéing with olive oil is ideal. And seniors who are on blood thinners like warfarin should always speak with their doctor before making drastic increases in vitamin K-rich foods, because it affects clotting mechanisms. Another critically important food for improving health in seniors is Greek yogurt, particularly plain, full-fat Greek yogurt without added sugars. This food is loaded with probiotics, calcium, protein, and B vitamins. Most seniors across the United States and Canada do not get enough protein, and this leads to muscle wasting, a condition known as sarcopenia. This is not just about looking frail. Sarcopenia increases fall risk, reduces independence, and shortens lifespan. A single serving of Greek yogurt can contain up to 20 grams of protein, which is more than many seniors get in an entire meal. Plus, the live probiotic cultures support gut microbiome health, which is tied to immune function, mental clarity, and even inflammation. The gut-brain connection is real. In older adults suffering from depression or anxiety, which is incredibly common in the United States and Australia, studies have shown that increasing intake of probiotic foods improves mood, energy, and even sleep quality. Calcium in Greek yogurt also supports bone health, while the B12 helps prevent nerve damage and memory loss. In seniors with low B12 levels, neurological decline can be so severe that it mimics dementia. That's a terrifying reality, and it's one that can often be avoided with proper nutrition. One elderly patient in Canada had been misdiagnosed with early Alzheimer's, only to later find that her only issue was an extreme B12 deficiency due to a poor diet. After only 6 weeks of daily high-protein, probiotic-rich meals, her mental clarity returned. However, seniors must choose their yogurt carefully. So many products sold in U.S. supermarkets are labeled Greek, but are loaded with added sugar, or artificial thickeners, which can raise blood sugar and harm the gut lining. Always read the ingredient label. It should contain only milk and live cultures. No fruit, no sugar, no additives. Another food that absolutely must be included in any health-focused diet for seniors is blueberries. These are not just another fruit. They are a therapeutic food with an incredible nutrient profile, especially for the aging brain and cardiovascular system. In the United Kingdom and United States, where dementia rates continue to rise every year, studies have shown that seniors who consume at least 1 or 2 cups of blueberries daily show improved short-term memory, better balance, and even slower cognitive aging. These berries are rich in anthocyanins, which are potent antioxidants that protect the brain from oxidative stress. Oxidative stress is one of the primary drivers of age-related diseases, from memory loss to heart disease to vision decline. The USDA found that blueberries have one of the highest antioxidant capacities of any fruit commonly consumed in the American diet. In one compelling story from a senior living community in New Jersey, residents who started a daily blueberry smoothie challenge saw increased alertness and reduced irritability within 3 months. These compounds also help improve insulin sensitivity, making blueberries a strong ally for seniors struggling with type 2 diabetes, which is rampant in the US and Canada. But don't mistake sugary blueberry muffins or artificially flavored yogurt for the real thing. Those are health traps. You need fresh or frozen wild blueberries, ideally organic to avoid pesticide exposure, which is especially dangerous for seniors whose detox organs, like the liver and kidneys, are already declining in efficiency. Blueberries also support urinary tract health, which is especially important for older women dealing with recurrent infections. They contain specific compounds that prevent harmful bacteria from adhering to the bladder wall, reducing infection risk without the use of antibiotics. A fifth essential food that seniors should be consuming consistently for better health is oats, especially steel-cut oats or old-fashioned rolled oats, not the instant kinds loaded with sugar. Oats are one of the most powerful tools for managing cholesterol, blood sugar, and even digestive health. In the United States, it's estimated that nearly 38% of adults over 60 have high LDL cholesterol, which increases the risk of heart attacks and strokes. Oats contain a special type of fiber called beta-glucan, which has been shown to significantly lower LDL cholesterol and stabilize blood sugar levels. Seniors in the UK who consume oats regularly have shown a noticeable reduction in total cholesterol within just 4 to 6 weeks. But it goes beyond numbers. This fiber also supports a healthy microbiome, improves satiety, and reduces post-meal sugar spikes that are dangerous for diabetics. Canadian healthcare providers are increasingly recommending oats as a first intervention for managing prediabetes in seniors instead of jumping to medication. The slow-digesting carbs in oats provide sustained energy, which is essential for older adults who often feel sluggish or fatigued. In Australia, dietitians have begun encouraging seniors to have oats in the evening as a light dinner option to stabilize overnight glucose levels and improve sleep quality. And oats also provide magnesium, phosphorus, iron, and zinc, minerals that support muscle function, immunity, and even mood regulation. However, preparation matters. You should cook oats with water or unsweetened almond milk. Avoid adding processed sugars, and instead top it with cinnamon, nuts, or berries for additional benefits. And avoid the microwave instant packets that often have more sugar than a dessert. One elderly man from Pennsylvania who struggled with constant fatigue and statin side effects managed to lower his cholesterol by 30 points in 2 months by switching to a daily oat-based breakfast with no medication changes. That's the power of food when used correctly. Another food that holds tremendous value for seniors seeking better health is avocados. These creamy fruits are one of the most nutrient-dense, anti-inflammatory foods available, and they're particularly important for older adults dealing with cardiovascular issues, cognitive decline, or poor nutrient absorption. Avocados are high in monounsaturated fats, which help increase HDL cholesterol, the good cholesterol, and reduce LDL cholesterol, the one that causes arterial plaque buildup. That's crucial for people in the United States, where heart disease remains the leading cause of death. In Canada and the United Kingdom, many seniors still rely heavily on low-fat diets from outdated guidelines. But studies are now showing that diets rich in healthy fats, like those in avocados, are more effective at protecting the heart and improving cholesterol profiles. Beyond heart health, avocados are loaded with fiber, potassium, folate, vitamin K, and magnesium, nutrients that most older adults are extremely deficient in. The potassium content is especially important for blood pressure control and muscle function. Many seniors experience frequent muscle cramps, arrhythmias, or weakness, often because their potassium levels are too low. Adding half an avocado a day can make a noticeable difference. In a clinical trial in Australia, seniors who consumed 1 avocado daily showed improved vascular function and better cognitive speed after just 12 weeks. There's also evidence that avocados enhance nutrient absorption from other foods. For example, if a senior eats a salad with tomatoes and carrots, but doesn't include a fat source, their body won't effectively absorb fat-soluble vitamins like A, D, E, and K. Adding avocado solves that problem naturally. And despite old myths, avocados don't make people fat. In fact, the high fiber and healthy fat combination helps control appetite, which is ideal for seniors struggling with blood sugar swings or even unintentional weight loss due to lack of appetite or illness. But it's important to eat them ripe and fresh, without combining them with highly processed ingredients like mayonnaise or fried tortilla chips. One of the most underestimated foods with powerful effects on senior health is nuts, especially walnuts, almonds, pistachios, and pecans. These are far more than just snacks. They are highly concentrated sources of nutrients that are essential for brain protection, joint health, and heart disease prevention. Walnuts, for instance, contain alpha-linolenic acid, ALA, a plant-based omega-3 that's been shown to protect against cognitive decline. In the United States, where nearly 1 in 9 adults over age 65 has Alzheimer's disease, simple changes like adding a daily serving of walnuts can reduce neuroinflammation and even improve memory. In one long-term study published in a US-based nutrition journal, seniors who ate just 1 ounce of nuts daily had a 30% lower risk of cognitive impairment. Almonds are another incredible option. They provide vitamin E, a powerful antioxidant that shields cells from oxidative stress. In fact, low vitamin E levels have been linked to faster cognitive aging and even nerve damage. Almonds also support blood sugar regulation, which is vital since diabetes and insulin resistance are major issues in the aging population, particularly in North America. Pistachios are rich in lutein and zeaxanthin, compounds that protect the eyes from age-related macular degeneration, which is the leading cause of vision loss in seniors in the United Kingdom and Canada. Pecans are high in manganese and copper, both of which help fight inflammation and support connective tissue health, reducing symptoms of arthritis and joint stiffness that are so common with aging. But portion control is key. Nuts are calorie-dense, and just a handful goes a long way. Many people make the mistake of buying trail mixes or flavored nuts coated in sugar or oils. That completely cancels out the health benefits. The best option is raw or dry roasted nuts, with no added sugar, salt, or oils. One elderly woman in Texas with severe arthritis saw her joint pain dramatically reduce after including a daily nut and seed mix with her lunch. Something so simple, but incredibly effective. Another powerful food for seniors looking to improve overall health condition is beans and legumes, especially lentils, chickpeas, black beans, and navy beans. These are nutritional powerhouses loaded with plant-based protein, iron, zinc, fiber, and folate. And what makes them even more valuable for seniors is their role in supporting cardiovascular health, blood sugar control, and digestive health. In the United States, where chronic conditions like heart disease, type 2 diabetes, and constipation are extremely common in seniors, legumes should be a weekly staple. In one major study conducted on older adults in the United Kingdom, regular consumption of beans was associated with a 22% reduced risk of cardiovascular events. In Canada, healthcare professionals increasingly recommend lentils and chickpeas to seniors with high blood sugar because of their low glycemic index, which means they release energy slowly and prevent glucose spikes. This helps prevent both hyperglycemia and hypoglycemia, which can be dangerous in older adults. Legumes are also incredibly high in soluble fiber, which binds to cholesterol in the digestive tract and removes it from the body. That means they naturally lower LDL cholesterol without needing statins. Plus, the fiber in beans feeds beneficial gut bacteria, improving immune function, mental clarity, and even mood stability. It's important to note that for seniors with weak digestion, legumes should be soaked overnight and cooked thoroughly to reduce gas and bloating. Sprouted versions are even easier to digest and more nutritious. Some seniors in assisted living centers in Australia were able to cut their cholesterol medication in half after adopting a high legume diet, monitored by a clinical nutritionist. It's essential to choose the right preparation. Skip canned versions loaded with salt or additives. Either use BPA-free canned beans with no salt or cook dry beans from scratch with herbs and olive oil for enhanced absorption and taste. Another game-changing food for seniors' health is eggs, especially pasture-raised eggs that are high in omega-3s, choline, vitamin D, and high-quality protein. For years, seniors in the United States were told to avoid eggs due to cholesterol concerns. But now we know that dietary cholesterol from eggs doesn't raise blood cholesterol for most people. In fact, eggs are one of the best foods for protecting brain function, muscle strength, and vision. Choline, found in the yolk, is critical for memory, neurotransmitter function, and cell membrane integrity. Many seniors in the UK and Australia are choline deficient without knowing it, and this contributes to fatty liver disease, cognitive decline, and muscle wasting. Vitamin D is also a huge concern. Up to 60% of seniors in Canada are vitamin D deficient due to lack of sun exposure and poor dietary intake. This deficiency weakens bones, reduces immunity, and increases risk of depression. Eggs provide a convenient and absorbable source of vitamin D, especially when paired with other vitamin D-rich foods like sardines or fortified milk. On top of that, eggs contain lutein and zeaxanthin, the same eye-protecting compounds found in green vegetables. That means seniors can protect their retina and macula by simply eating eggs regularly. One elderly man in Ohio, who was struggling with poor memory and falling balance, began eating 2 omega-3 eggs every morning and experienced noticeable improvements in alertness and stability within 8 weeks. The protein also helps with muscle repair and immune resilience, both of which decline significantly with age. The key is to avoid highly processed egg substitutes or pre-cooked eggs from fast food chains. Those often contain preservatives and low-quality fats that cancel out the benefits. Make eggs at home with healthy fats like olive oil or grass-fed butter. And don't skip the yolk. That's where most of the nutrients are. A deeply healing and often forgotten food for seniors is bone broth. This is not just soup. It is a collagen-rich, mineral-loaded liquid that can deeply nourish aging joints, skin, and gut lining. Seniors in the United States frequently deal with leaky gut, arthritis, wrinkled skin, and poor nutrient absorption. And collagen is the missing link that most people overlook. Bone broth made from grass-fed beef bones, organic chicken, or wild-caught fish bones contains gelatin, collagen peptides, glycine, and glucosamine, which are crucial for repairing tissues that degrade with age. In Canada, some wellness clinics now prescribe daily bone broth to seniors with inflammatory bowel issues like ulcerative colitis or Crohn's disease because it helps heal the intestinal lining and reduces flare-ups. The amino acids in bone broth also support liver detoxification, improve sleep, and calm the nervous system. Many elderly patients in the United Kingdom have started using bone broth during flu season as a natural immunity booster, especially when combined with garlic, turmeric, and ginger. It's important to note that store-bought broths rarely have any collagen. Only homemade or high-quality frozen versions contain the nutrients. A senior woman in California with chronic knee pain and IBS began drinking 1 cup of homemade bone broth daily and experienced dramatic improvements in mobility and digestion within 2 months. Seniors should simmer bones slowly for 12 to 24 hours with a little vinegar to extract the minerals and nutrients effectively. The broth should gel when refrigerated. That's the collagen. Adding it to meals or sipping it before bed is an excellent, low-effort way to increase nutrient intake without chewing large portions or taking supplements. Another key food that can transform a senior's health condition is sweet potatoes, particularly the orange and purple varieties. These aren't just comfort food, they are some of the most nutritionally dense carbohydrates available. For seniors, in the United States, Canada, and Australia, sweet potatoes offer a safer alternative to the blood sugar spiking effects of white potatoes and refined grains. They are packed with beta-carotene, which the body converts to vitamin A, a nutrient essential for immune function, eye health, and skin repair. Vitamin A deficiency is surprisingly common in older adults, especially those with digestion issues that reduce nutrient absorption. Sweet potatoes are also a rich source of fiber, potassium, vitamin C, magnesium, and complex carbohydrates that provide sustained energy without causing a sugar crash. Seniors who feel sluggish, suffer from chronic fatigue, or experience poor blood sugar control can benefit from including sweet potatoes regularly, especially when baked or steamed and served with a small amount of healthy fat, like olive oil or grass-fed butter, to increase vitamin A absorption. In the United Kingdom, doctors treating seniors with chronic constipation often recommend increasing soluble fiber intake, and sweet potatoes help with exactly that. In one example from a senior rehab center in Oregon, residents who added half a sweet potato to dinner 5 times a week had significant improvements in bowel regularity and daytime energy. Purple sweet potatoes are even more potent, with compounds that fight oxidative stress and inflammation, both major factors in dementia and cardiovascular disease. They've been studied in Okinawan populations, where a high intake of these tubers is linked with extreme longevity and minimal rates of cognitive decline. For seniors trying to stay sharp and independent, swapping processed grains or pasta for sweet potatoes even 2 or 3 times a week can make a difference in energy, digestion, and focus. A powerful but often overlooked food that seniors should take seriously is sardines, especially wild-caught ones packed in water or olive oil. Sardines are one of the most nutrient-rich foods available and provide omega-3 fatty acids, vitamin D, calcium, selenium, and high-quality protein, all in a form that's incredibly easy for older adults to digest and absorb. They contain EPA and DHA, the same brain-boosting and heart-protecting fats found in salmon, but in a more concentrated serving. Seniors in the United States and Canada who struggle with memory problems, heart arrhythmias, or joint pain often suffer from chronic omega-3 deficiency. Sardines also offer bone-building calcium and vitamin D, which are essential for preventing fractures, especially in seniors at risk of osteoporosis. Unlike most calcium supplements, the calcium in sardines comes from natural fish bones that are soft and fully digestible. In the United Kingdom, nutritionists often recommend sardines to older women post-menopause to maintain bone density naturally, without medications that can have harsh side effects. The vitamin D also supports immune resilience, which becomes more critical with age when respiratory infections and inflammation-related illnesses are more common. A senior in Florida who had recurring falls due to bone weakness was able to increase her bone density by 8% over 12 months through a nutrient-focused diet that included sardines 3 times a week. Sardines are also budget-friendly, shelf-stable, and easy to prepare. No cooking required. They're especially useful for seniors who live alone or have limited mobility. However, it's important to buy wild-caught sardines with no added sauces or preservatives. Avoid versions packed in soybean oil or tomato sauce with added sugar and sodium. Just 1 small can of sardines can deliver over 300 milliliters of calcium, 15 grams of protein, and more than 100% of daily omega-3 needs. An incredibly efficient way to boost health from head to toe. Turmeric is another critical food, or rather, spice, that should be considered a health essential for seniors. Used for centuries in traditional medicine, turmeric contains a powerful compound called curcumin, which is one of the most studied anti-inflammatory substances in the world. In Australia and the United States, where chronic inflammation is a silent driver behind many age-related conditions like arthritis, Alzheimer's, heart disease, and even cancer, turmeric can make a serious impact. In clinical studies, curcumin has been shown to be as effective as some anti-inflammatory drugs, without the side effects. For seniors with joint stiffness, brain fog, high CRP levels, or digestive issues, a small daily dose of turmeric, especially when combined with black pepper for increased absorption, can bring noticeable relief. In a pilot study in Canada, seniors with osteoarthritis who added just 500 milliliters of curcumin to their meals daily reported less pain, better sleep, and improved mobility within 30 days. Turmeric also protects the liver, supports metabolic health, and promotes healthy blood vessels, which is crucial for preventing strokes and improving circulation in older adults. However, you need to use the right form. Sprinkling a little turmeric powder into your food isn't enough for therapeutic effects. It needs to be combined with black pepper, which contains piperine, or consumed with a healthy fat, like in golden milk or turmeric tea with coconut oil, to maximize absorption. Some seniors choose high-quality turmeric supplements, but food-based forms are always safer when digestion allows. One elderly couple in Arizona began incorporating turmeric into soups, rice dishes, and smoothies daily. And after just a few weeks, both reported significant reductions in their morning joint pain and more flexibility throughout the day. Turmeric may even play a protective role against cognitive decline by reducing amyloid plaque formation in the brain, which is a key factor in Alzheimer's progression. For this reason, many doctors and functional medicine practitioners in the United States now recommend turmeric as a foundational spice in aging nutrition. Another essential addition for seniors striving for better health is garlic, which is far more than just a flavor enhancer. Garlic contains allicin, a compound with strong antibacterial, antiviral, anti-inflammatory, and cardioprotective properties. Seniors in the United Kingdom and Canada, where antibiotic resistance and immune decline are growing concerns, benefit immensely from garlic's immune-enhancing capabilities. In the United States, garlic is increasingly studied for its ability to reduce blood pressure, improve circulation, and lower cholesterol, all of which are essential for reducing risk of heart attack and stroke, still the top causes of death among older adults. Garlic also has unique properties that thin the blood naturally, improving blood flow to the brain and extremities, which is vital for seniors dealing with cold hands and feet, dizziness, or early memory decline. In studies, older adults who consumed garlic regularly showed stronger immune response during flu season and fewer upper respiratory infections. Some research even links garlic to a reduced risk of certain cancers, particularly colon and stomach cancer, thanks to its rich content of organosulfur compounds. But to unlock these benefits, garlic needs to be prepared properly. Crushing or chopping fresh garlic and allowing it to sit for 10 minutes before cooking activates its medicinal compounds. Cooking garlic too quickly at high heat can destroy allicin, so it's best to add it at the end of cooking or use it raw in dressings, dips, or as a finishing touch on warm dishes. One elderly man from Massachusetts who had frequent colds and borderline high blood pressure began eating 2 cloves of raw garlic with lunch each day and saw dramatic improvements in his blood pressure readings, energy, and resilience to infections. The key is consistency. Garlic capsules and powders often lack potency and can cause stomach irritation, while whole food garlic, used properly, delivers robust and lasting benefits. And finally, an absolutely vital but under-prioritized food for seniors is fermented vegetables, especially sauerkraut, kimchi, and pickled beets, made without vinegar or artificial preservatives. These foods are rich in probiotics, the good bacteria that restore and maintain a healthy gut microbiome. In the United States, many seniors have a completely imbalanced microbiome due to decades of processed food consumption, antibiotic use, and lack of fermented foods. This leads to issues like poor digestion, bloating, weak immunity, and even depression and cognitive decline. The gut is often referred to as the second brain, and for good reason. More than 70% of the body's immune cells reside in the gut. In the United Kingdom and Australia, geriatric dietitians are now emphasizing gut health as a cornerstone of aging care. And fermented vegetables are one of the easiest ways to repopulate the gut with beneficial strains like lactobacillus and bifidobacterium. These bacteria help break down food, improve nutrient absorption, and reduce inflammation. In one retirement community in British Columbia, residents who began eating 1-2 tablespoons of raw sauerkraut with meals noticed better bowel function, reduced gas, and less dependency on fiber supplements and laxatives. Seniors need to avoid the pasteurized versions sold in many American supermarkets. Those have been heated and lost all beneficial bacteria.